Hi everyone, my name's Juana, and I guess I have the first week, so please bear with me if this is a little bit weird at first. So today I wanted to pick the topic of workplace violence. I'm a GRA on a study on workplace violence in outpatient clinics right now, so this is something that's been on my mind a lot lately. And in the literature review that I've done for that project, I have found some quite striking disparities based on gender. Um, and I wanted to focus on female workers in healthcare since there's quite a bit of literature on the healthcare workplace and workplace violence in that setting. And so, in my literature review that I did for this class, I actually found that there isn't much published in the past 3 years focusing on gender based disparities in the United States. And I did want to focus on the United States, but I did find one paper that reported on gender based disparities, even though it wasn't its focus. So this is the paper that I wanted to pick for the week. So it's the impact and prevalence of physical and verbal violence towards healthcare workers, published in Psychosomatics. And it should be, I think it's a free full text, but I know the full text is available if you use the one search function in the TMC library website. So I picked some of the questions on the template to discuss today. First, what is the main intent of the authors? Before I do that, let me just quickly summarize the paper itself. So they were looking at the epidemiology of workplace violence in the hospital setting, along with a couple of secondary goals, but they found that 34% of the surveyed workers reported an experience of physical or verbal aggression, and 60% of those had post-traumatic symptoms. So for the main intent, the quote here says the goal was to determine the prevalence, location, and type of healthcare worker experience with physical or verbal abuse by patients or families. And so the primary goal was to basically report on the epidemiology of workplace violence in this setting, with the secondary goals of the efficacy, looking at the efficacy of their reporting system versus the administered survey for the research project. And they also looked at the effect of workplace violence on worker engagement and the epidemiology of post-traumatic symptoms. So for the methodology, they conducted an online survey at the Northwestern Memorial Hospital, which for context is tertiary care in an urban location in an academic medical center. And the tools that they used, they looked at the HR reporting system for workplace violence, and they also conducted their own survey, which they administered through email. And the population that they targeted was physicians, nurse practitioners, physician assistants, nurses, social workers, and CNAs working at this hospital for a minimum of a year. And then they mentioned that respiratory therapists, physical therapists, occupational therapists, radiology techs, and trainees were excluded. So I personally thought that this methodology was not ideal because of the study site in particular. It's tertiary care in an urban area, and that would not accurately reflect places that are probably riskier, such as psychiatric institutions or community health centers. Um, and furthermore, they didn't say why they excluded all of these different categories of healthcare workers that still do have patient contact, except maybe radiology techs. So that kind of made the results a little bit less representative of what you would normally see. And then also, the employees that they surveyed were required to have been employed at this hospital for a minimum of 1 year. And again, they didn't say why they would have excluded those working there for less than a year, but I mean, workplace violence doesn't discriminate based on how long you've been working at one place. So, just a couple of things to keep in mind when looking at the results. So, what did they conclude? I just selected the gender related disparities to report on. So females composed almost 80% of their sample, but males reported significantly more assaults than females, and they reported that in number of events per worker. And they also reported significantly more verbal assaults than females. And the reports on physical assaults, they were not significant, so I didn't want to focus too much on that. But they also asked the question of what the violent events were attributable to, and they attributed 16% of verbal assaults to be based on gender. So clearly there is a disparity, at least in the assaults that are reported. I don't think that the amount of assaults that are reported accurately reflect the assaults that are happening. So I kind of wanted to discuss why, like, these results might not accurately reflect what's actually going on. So, what determinants might be contributing to the findings in this study? So, even though these findings report that it seems like more violent events are happening towards men, it really only shows us the amount of the violent events that are actually reported. So, for determinants, I would prefer to ask what factors would explain why males report more than females, and why would females report less than males. So I think there are a lot of barriers to reporting, not only just in worker education, but also in inherent sexism in the in work life, especially for women. I think there's a lot of rampant sexism in the employee infrastructure. So I think that would be the major determinant to why females would be less likely to report their violent events. And there are also a few research studies conducted, I think, in Europe, showing that females actually perceive violent events, mostly verbal aggression, to be part of their job. And this is actually more focused on nurses, but since females generally tend to become nurses more so than males, it kind of works as a proxy. So that also might be another determinant contributing to the findings in this study. And so that's the paper that I wanted to talk about, and just to kind of emphasize the fact that, you know, it's kind of hazy why males report more than females, or why males seem to experience more assaults, but there is another paper that I found looking at newly licensed RNs. So you can see from this passage that I highlighted that female nurses more frequently experienced violence, verbally and physically, compared to male nurses in one study. But then another study conducted a little bit earlier found the opposite. And these two studies were actually conducted in different locations. I think Alamari was somewhere in the Middle East. So there's a lot of variation based on geography, and also I think, you know, after the ACA, things have changed a lot in terms of reporting, and certain clinics, if they have less than 50 workers, I believe, don't have to report on workplace violence to NIOSH or OSHA. So there are a lot of factors in play here. I think it just highlights why we need to keep an eye on intersectionality and thinking of all the different systems that might prevent people from reporting violent events in the workplace.